Hello friends, myself Dr. Asmita Dwivedi, and through this video we will learn some important sign and disease associated with it. Nikolsky sign. Nikolsky sign is seen when we rub off the skin. There is loss of epithelium due to rubbing, and it results in raw sensitive surface. It occurs due to when we apply lateral pressure, and it is seen in pemphigus. Pemphigus. It is one of the differentiating feature between pemphigus and pemphigoid. In pemphigoid, Nikolsky sign is absent. And recessive epidermolysis, also seen in recessive epidermolysis bullosa. Recessive epidermolysis bullosa. Next sign is shown in the figure is Auspitz sign. When we peel off this scale, white scale, here tiny bleeding points appear. This is known as Auspitz sign, and it is seen in psoriasis. Hygomaniac sign. It is thickening of sternoclavicular joint, and it is seen in congenital syphilis. It is irregular thickening of sternoclavicular joint. Moving further, this is Trosse sign, this is Chauvistek sign. Both of these signs are seen in condition when there is fall in calcium level, that is hypocalcemia. They are seen in tetany. Here, calcium level falls. Trosse sign is also known as obstetrician hand. As their finger, hand is appearing like obstetrician hand, and it occurs when we put sphygmomanometer, and the carpal spasm occur after application of pressure on the arm with sphygmomanometer. And the Chauvistek sign, when we tap at the angle of jaw, it stimulates the facial nerve. So in the figure, there is twitching of the muscle of face on the same side. Both of them are seen in low calcium level. Now, the raccoon sign. Raccoon sign is seen in basilar skull fracture. Basilar skull fracture. It in this there is periorbital ecchymosis. There is periorbital ecchymosis, and the sub. It's not so clear in this figure, but there is sub conjunctival hemorrhage, and it occurred due to secondary to the blood dissecting from the disrupted skull to the receptive skull cortex, and it reaches to the soft tissue of periorbital region. Due to this, there is formation of subconjunctival hemorrhage. Next sign is battle sign, and it is seen battle sign. What it is ecchymosis in the mastoid region. Over the mastoid region in the figure, it is clearly seen that there is ecchymosis in the mastoid region, and it is seen in subcondylar fracture. It is seen in subcondylar fracture. Involving base of skull, subcondylar fracture involving base of skull. ecchymosis is in mastoid region, and in a, while I'm giving MCQ, they confuse that. They write option like battle sign present in pre-auricular region, but mark this word, they are present in post-auricular region. Post-auricular region. Next sign is Gurion sign. Gurion sign is seen in leaf foot 1 fracture. Leaf foot 1 fracture. And here it is due to ecchymosis in the greater palatine region. Near the greater palatine foramen, when ecchymosis occurs, Gurion sign form. Now, Murphy sign. Murphy sign is seen in cholecystitis. Just we have to learn this. This is Murphy sign and it is seen in cholecystitis. Not much detail is needed in this. In this figure, it is showing, sorry. In this figure, it is showing teardrop sign. Teardrop sign is also known as hanging drop sign. It is seen in, it is a radiographic feature. Now, it is also known as hanging drop sign. Hanging drop sign. It indicates orbital floor fracture. Orbital floor fracture. Okay. And it is due to herniation of inferior oblique and inferior rectus muscle into antrum. And it is best seen in Waters projection. In this, there is herniation of two muscles, herniation of inferior, inferior oblique and inferior rectus muscle into antrum. Here in the circle, see that is teardrop sign. Now, crow sign. Crow sign is here in this we see axillary freckling. These red spot in axilla is axillary freckling and it is seen in von Recklinghausen neurofibromatosis. It is also known as elephant man syndrome. This is axillary freckling, axillary freckles. Elephant man syndrome. Next. Now, this cluster of jewel sign. Cluster of jewel is also as in the figure it is appear like pearls or rosette sign. Okay, so this sign is also known as rosette sign and also known as rosette sign, and it is seen in early stage of chronic bullous disease of childhood when a new lesion appear. In this, a new lesion appear and the margin of older one resembling a cluster of jewel. Okay, here means the new lesion, these red area, they are the new lesion, they form in the region of lesion, they are formed around the older lesion. That's why it appear like cluster of jewel and seen in chronic bullous disease of childhood. Chronic bullous disease of childhood. Next is Du Bois sign. Here shown the finger, there is shortening of little finger. Here shortening of little finger. Okay, it is Du Bois sign and it is seen in congenital syphilis. Congenital syphilis. Now, Tintac sign. Tintac sign, here there is hypopigmented area and around this there is hyperpigmented border. This Tintac sign and is also known as carpet tax sign. It is seen in discoid lupus erythematosus, also known as carpet tax sign, seen in discoid lupus erythematosus. Next. Now, the first figure is depicting slapstick sign. When we slap someone on the face like this, red area form, this is slapstick sign. It is seen in children with fifth disease. Fifth disease. Okay, and it is also known as erythema infectiosum, occur due to infection of parvovirus B19. Okay, here as a confluent erythematous plaque like lesion form on cheek area. Okay, so what is the important takeaway point from this sign is this: firstly it is slapped cheek sign seen in children's with fifth disease. Due to infection of parvovirus B19, also known as erythema infectiosum. Now, the next sign is shawl sign. Appearing like shawls when we cover shawl, when we put our shawl on the neck from back, it's appear like this. So it is known as shawl sign. It is seen in patient with dermatomyositis. Dermatomyositis. Recently, an actress of the film, what we Amir Khan film Dangal, actress died due to this dermatomyositis. dermatomyositis. Sol sign seen in dermatomyositis is confluent, symmetric, macular, violaceous erythema on post shoulder and neck, giving a distinctive shawl-like appearance. ठीक है? It is confluent, symmetric, and macular violaceous erythema. This confluent, symmetric, macular, violaceous erythema. Next sign is Russell sign. It is seen in bulimia nervosa. Owing to repeat, because in this patient tried to vomit out everything which they have eaten. So bulimia nervosa owing to repeated contact of incisor teeth with the skin and during the self-induced vomiting. When they self-induce vomiting, the finger come in contact with the incisor teeth. So it leads to formation of Russell sign. Seen in bulimia nervosa due to self-induced vomiting. Moving further, now this is necklace of Castle sign. It is hyperpigmentation occurring in the neck owing to pellagra. Okay, it is seen in pellagra. The necklace can extend as a broad collar-like band around the entire circumference of neck, and it is due to deficiency of vitamin B3. So, what is the takeaway for this sign is just occur due to deficiency of vitamin B3, also known as niacin. And vitamin B3 niacin deficiency lead to disease pellagra. So it is basically seen in pellagra. Next sign is Jelinek sign. Jelinek sign is seen in hyperthyroidism. Okay. In this figure we are seeing the eyelid pigmentation over the upper eyelid. So seen in hyperthyroidism, the hyperpigmentation is due to secondary increase of corticotrophin levels and may also occur on other areas of face but usually spare the buccal mucosa. So Jelinek sign is just hyperpigmentation at upper eyelid and it is seen in hyperthyroidism. Seen in hyperthyroidism. Next, this Hutchinson nose sign. Okay. In this we are seeing the vesicle over the nose area. This is Hutchinson nose sign and it is seen in herpes zoster. Vesicle occurring vesicle occurring on tip of nose. Next sign is Hogland sign. What is shown in this picture? There is swelling, bilateral upper eyelid edema. Upper lid edema है upper eyelid के ऊपर bilateral. So it is Hogland sign. It is present only for first few days of first few days in infect and seen in infectious mononucleosis. Present only for first few days of clinical presentation of illness. Okay. This swelling early and transient, bilateral upper eyelid edema. Seen in infectious mononucleosis. Next sign is Gorlin sign. Patient is able to touch the tip of tongue to nose and seen in Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Next sign is Forsheimer spot. Forsheimer spot is seen in rubella. There is red macule or petechiae confined to soft palate. Is it? Only in soft palate, not at hard palate. Okay. So they are confined only in soft palate. It is present in 20% of patients with prodromal symptom. That is, fever is present on first day of exanthema. It is red macule or petechiae confined to soft palate, seen in rubella. Sorry. Okay. Confined to soft palate. Okay. And seen in rubella, which is also known as German measles. German measles. Next sign is flag sign, and it is seen due to nutritional deficiency. Kwashiorkor, in when there is high dose of drug methotrexate, means seen in methotrexate chemotherapy, and also seen in ulcerative colitis. What is flag sign? There is horizontal alternating band of discoloration in hair shaft corresponding to the period of normal growth. This flag sign there. This figure, there is discoloration, there is grayish area in the hair. This flag sign. And seen in, there are so many reasons. So there is nutritional deficiency. Nutritional deficiency, that is Kwashiorkor. In intermittent high dose of methotrexate chemotherapy. and in ulcerative colitis.